Have you ever had a good night's sleep but still felt tired in the morning? Fatigue is very complicated and it's not just about sleep. So let's get to the bottom of this together and figure out why you might be tired. Fatigue or tiredness has many complex causes and is more of a syndrome or a symptom than an actual diagnosis. And you may be surprised by how many things can cause it. So hang with me till we get to the bottom of this. And as a reminder, I am a doctor, but not your doctor, and this is purely educational information. All right, let's start with one of the most common issues, which is the tiredness that results from refined carbohydrates and processed foods, especially those with high sugar content. Now, remember, our bodies are not designed to be exposed to this level of sugar. So we're going to have constant and downs in our energy and crashes and possibly a new set point for energy levels because of the food intake. In addition, you may have been thinking about anemia, which is also a really important thing to check if you can get a simple blood test. When you have low red blood cell counts in your blood, you're going to feel tired. And there's dozens of causes of anemia, some of which we'll go into, but you want to rule this one out with a simple blood test. So starting off with things that are super common. Also, iron deficiency is something that is very common in the population that people often don't get checked. And you can have iron deficiency even without anemia. So you want to get this blood level checked. In addition, you may have been thinking of insomnia, and chronic insomnia is definitely very common. So this is an easy fix. Not that fixing insomnia is easy, but it's easy to identify as the cause. So you want to get right on top of that. And similarly, sleep apnea is very common as obesity levels go up. And remember, snoring is not normal. If you or someone you love is snoring, get a sleep study. It could explain your fatigue. In addition, depression has as a side effect low energy. And this is an often undiagnosed cause of fatigue in people. You can quickly get treatment because the average person takes years and years to get help for depression. So don't forget about depression. Vitamins and electrolytes are also very reversible fixes for fatigue. So low calcium levels, low vitamin B12, low vitamin D. All of these can be quickly checked with a blood test and easily reversed. In addition, don't forget about your thyroid. Low thyroid function has as a side effect fatigue. This is also something you can get checked with a simple blood test from your primary care doctor. And it's also fairly reversible. Now, getting into a little bit more rare and complex stuff, infections themselves can have a side effect of causing fatigue, often because the immune response itself has as its functionality a mechanism by which it causes the organism to feel fatigue when it's fighting bugs off. Epstein-Barr virus, also known as mononucleosis, Lyme disease, tuberculosis, hepatitis A, B, or C. In addition, HIV and endocarditis, and there's dozens of infections that cause people to feel fatigue. So don't forget to rule out infection. You can get this also checked up with a simple blood test where your doctor will be able to tell if there's an infection going on in your blood. All right. And now also pretty common is diabetes. And because of the fluctuations in blood sugar, people can often feel fatigued. And also because of the dysregulation of insulin signaling, you can have fatigue. So check that with a simple blood test as well. Chronic kidney disease often has as a side effect fatigue, and the dysfunction in toxic metabolites that build up in the blood can result in fatigue. And that's also true for liver dysfunction. So get both of those checked. Many medications are prescribed to treat one thing, but because they're going throughout your whole body, they're going to have a side effect, many other things. So beta blockers are for your heart and sometimes for anxiety, but they can also result in some fatigue. Antihistamine medications, for example, for allergies or anxiety, can also result in fatigue. Benzodiazepines like Ativan or Clonopin or Xanax, when given not at the right time and in the right dose, can result in sedation or fatigue. Don't forget alcohol. Good old alcohol and other substances can result in fatigue because of the direct effects of the substance or its side effects. And similarly, fibromyalgia is extremely common, and many clinicians falsely assume these patients are faking it. But when we look at what's happening in the brain, we see characteristic changes that pretty much match what the person is saying. There's central sensitization of the pain response. The neurobiological networks responsible for pain are hair triggered and are overactive. And the fatigue that accompanies the chronic pain syndrome can be very debilitating. Similarly, for chronic fatigue syndrome, which is cousin of fibromyalgia, which in many cases is a post-viral fatigue syndrome, sometimes emerges after a mysterious virus, also called myalgic encephalopathy, getting more attention and research into some of the underlying causes. It's important to know what's going on before you try to treat it. If you get the diagnosis wrong, the intervention could be useless or even harmful. Similarly, autoimmune disorders as a side effect often result in fatigue. Rheumatoid arthritis, lupus, multiple sclerosis, Hashimoto's thyroiditis, celiac disease, and even inflammatory bowel disease, such as Crohn's disease. There's something about the autoimmune response that itself can result in fatigue. You want to get a good workup for these things, try to carefully keep track of your symptoms, and get the right diagnosis. In addition, chronic obstructive pulmonary disease or COPD, which is a chronic respiratory condition that can be quite debilitating because of the way oxygen and carbon dioxide are exchanged differently and the way the body's oxygenation becomes affected. People will often have a lot of fatigue with this. In addition, don't forget about cancers, which cause inflammation in the body and often, as a result, also induce anemia. And then, in addition, the chemotherapy itself can sometimes result in fatigue. So now, of course, this is more uncommon than some of the other things, but leukemia, lymphoma, colon cancer, breast cancer, ovarian cancer, these are some of the most likely to induce fatigue, as well as prostate cancer and multiple myeloma. It's important to get the right kind of help. And congestive heart failure, where the heart pump is not functioning effectively and the ejection fraction is lower, people are going to have fatigue and difficulty with exertion. But this is now getting quite rare. And similarly, adrenal insufficiency is quite rare. So the adrenal glands are responsible for producing a lot of these hormones that give you energy. And when they're not working, you can have that as a side effect. So I hope I've been able to help you figure out some of the other reasons why you might be feeling tired. If you found this helpful, check out this other video, subscribe to my newsletter. Take care.